All right, let's get right into it. Today we're going way beyond the usual stuff like rashes or achy joints. We're talking about the really serious hidden signs, the clues that your autoimmune disease, things like lupus, rheumatoid arthritis, or sjogrens, might actually be attacking your organs from the inside.
So really think about this for a second. Is your autoimmune disease more than just skin deep? Because, it's so easy to get caught up in the symptoms you can see and feel every day. But what if there's a much bigger, more dangerous battle happening inside that you don't even know about?
And that's exactly why we're talking about this. I mean, the source for this explainer just nails it. They say this is about the hidden organ damage that, get this, most people and even doctors could miss. That's huge. This is information you absolutely need to have in your back pocket.
Okay, so first up, let's talk about those times when you just feel off. You know what I mean? Those vague, nagging feelings that are so easy to just brush aside. Oh, I'm just stressed, or it's just been a long week. But what if those feelings are actually major red flags? Signs that your body is fighting a secret war inside.
And this brings us to the first and maybe the most common sign. Look, we all get tired, right? But this is a whole different beast. We're talking about an exhaustion so profound, it just completely hijacks your life.
So here's the real difference. Regular tired, a good night's sleep, maybe a nap, and you're feeling better. But this crashing fatigue? Nope. It doesn't care how much you rest. It's this bone-deep exhaustion that can stick around for weeks or even months. That's a huge signal that inflammation is just out of control in your body.
You ever find yourself saying, "I'm just not feeling myself lately"? Yeah, that phrase right there, it's a massive clue. It's often pointing to our second sign, brain fog. That frustrating feeling when you just know your brain isn't firing on all cylinders like it should. Let's dig into what that actually feels like.
And let's be super clear here, this isn't just about misplacing your keys. When your immune system starts messing with your nervous system, we're talking about real memory issues, brutal headaches, or even a sudden intense wave of anxiety or depression you've never had before. This is a potential sign that the attack is happening in your brain.
Now, because it's so easy for someone to say, "Oh, everyone gets brain fog," you need an action plan. And your most powerful weapon? A symptom journal. Seriously, it's not just a diary, it's hard evidence you can take to your doctor to show them exactly how this is messing with your day-to-day life. All right, let's shift gears. We're moving on from the vague off feelings to the full-blown emergency alarms. These next signs are not subtle. They're sharp, they're specific, and they can be actual medical emergencies that you need to act on fast.
Okay, sign number 3 might surprise you. Do you have trouble swallowing? I mean, does it ever feel like food or even water is just getting stuck? If that's happening, you cannot wait around on this one.
And here's why it's a 5-alarm fire. That runaway inflammation, especially from something like polymyositis, can literally attack the muscles in your throat that let you swallow. If you don't get it treated, you're looking at a real risk of permanent damage, not to mention nasty lung infections from aspirating food.
Now, the fourth sign isn't just one thing. It's a whole group of symptoms that all point to a condition called giant cell arteritis, or GCA. Basically, it's a really aggressive inflammation of your blood vessels, and it is a true emergency, particularly if you're over 50.
So here's what to look out for, okay? A brand new, really bad headache, especially around your temples. A scalp that's so tender it hurts to brush your hair. Pain in your jaw when you're chewing. And any kind of blurry or dark vision. If you get a few of those together, especially with stiff shoulders and hips, you need to get help, like right now.
And let me tell you why it's so urgent. If you don't treat this, up to 20%, that's 1 in 5 people, will lose their vision permanently. We're talking about stakes that could not be higher.
But, and this is a huge but, look at this. With quick treatment, we're talking high-dose steroids. That risk of blindness drops to less than 1%. That's an incredible difference, right? It just shows you that acting fast can literally save your eyesight.
All right, sign number 5 is another big one, suddenly struggling to breathe. It's so easy to think, oh, I'm just out of shape. But if you have something like RA or lupus, this could be a sign that the disease is quietly going after your lungs.
What's happening is that the inflammation is causing scarring. Think of it like your lungs are becoming stiff and less flexible. It's a condition called interstitial lung disease, and if you don't catch it early, it can make something as simple as breathing a constant, permanent struggle.
Okay, on to our last category, and honestly, this might be the scariest one.
the silent organ attack. These are the threats that build up without any warning. They're so insidious because they can do catastrophic damage before you even know they're there.
The source material uses a metaphor here that is just perfect. It says, inflammation isn't just about an ache, it's a fire inside your body. And that's exactly right. It's like this slow, smoldering fire that's quietly burning away at crucial things like your heart and your blood vessels.
And sign number 6 is all about the consequences of that fire. The numbers are just staggering. If you have untreated RA, your risk for a heart attack, for heart failure, for a stroke, it doesn't just go up a little bit. It can double or even triple. That's a massive increase.
And here is something absolutely critical to know. A heart attack in someone with an autoimmune disease might not look like the Hollywood version, the crushing chest pain. Especially for women with lupus, it could show up as severe nausea, sudden stomach pain, or just that crashing fatigue we talked about. This is life-saving information right here.
And that brings us to our 7th and final deadly sign, kidney damage. Your kidneys are a huge target for autoimmune attacks, but the clues are so subtle. We're talking puffy ankles, foamy-looking urine, or a sudden jump in your blood pressure. These quiet signs could mean that inflammation is wreaking havoc on your kidneys, and that can lead to things like dialysis or even a transplant down the line.
Wow. Okay, we've gone through some really heavy stuff, but I don't want to leave you feeling scared. I want to end this by shifting from all these warnings to a feeling of empowerment. Because at the end of the day, the single most powerful tool you have for your health is you.
And this right here is the heart of it all. Think about it. So many life-saving diagnoses don't happen because of some perfect textbook symptom. They happen because a patient, someone just like you, knew deep down that something was wrong and insisted on getting answers. Your gut feeling matters a lot.
So, if there's one thing you take away from all this, let it be this: you are your own best advocate. Trust yourself. When something feels wrong, you have to speak up. Pushing for answers isn't being difficult. It could literally save your life.
So now you know the signs. You're armed with this really important knowledge. The question is, what comes next? What are you going to do with this information to stand up for your own health starting tomorrow?